In the world, 10% of people have an eating disorder at some point in their lives. However, there is a serious misunderstanding of eating disorders. It can be challenging to deal with an eating problem or to support a loved one who is dealing with it due to misconceptions about everything from symptoms to treatments. Let's go over some facts and myths surrounding eating disorders. What is an eating disorder, first of all? Restricting food intake, binging or consuming huge amounts of food quickly, and purging or removing calories through vomiting, laxatives, excessive exercise, and other unpleasant methods are the three main behavioral patterns associated with eating disorders. Any one of these habits alone or in combination can indicate an eating disorder. Eating disorders are psychological problems marked by significant and ongoing disturbances in eating patterns and the uncomfortable thoughts and emotions that go with them. These conditions, which can influence one's ability to operate physically, mentally, and socially. For instance, individuals with anorexia typically limit their calorie intake, but individuals with bulimia nervosa experience frequent binges and purges. There are actually different symptoms associated with eating disorders, but the most frequent ones are an unusually low or high body weight, a desire to eat privately or covertly, after a meal, frequent restroom visits, fixation with rapid weight growth or loss, fixation with outward appearance and how others see you, remorse and embarrassment over one's eating habits, abnormally stressed, worried, or uncomfortable with one's eating habits. These actions determine if a person has a genuine eating disorder, which is significant. An individual's weight alone cannot diagnose an eating disorder. When eating disorders are severe, they can cause long-term health problems like osteoporosis, anemia, heart disease, and kidney damage in people who weigh within what doctors might consider a healthy weight range. We can't simply change our eating habits to cure eating disorders, just as we can't identify if someone has one based solely on their weight. This is because eating disorders are fundamentally psychiatric diseases. We believe that they include a change in how someone perceives themselves. The majority of those who are experiencing them are extremely critical of themselves and list numerous shortcomings they believe they possess. Eating may be a way for them to attempt and recover some control over their internal turmoil. What precisely causes eating disorders is still a mystery. There's probably more than one contributing factor, including genetic and environmental risk factors, and sometimes the symptoms of eating disorders can be brought on by other mental conditions like depression or worry. Additionally, some psychological traits like perfectionism and a negative body image might lead to an eating disorder. Additionally, several social issues like internalizing bullying, racism, and ethnic assimilation, and a lack of social networks all play a role. Despite the widespread belief that eating problems exclusively affect women, both sexes are susceptible. People are prone to having these diseases during adolescence since they have a direct impact on how one develops their identity and self-esteem. Although these conditions can be difficult, there are successful therapies and interventions, and many patients who get therapy recover completely. The sooner treatment is started when someone begins to engage in eating disorders, the greater the likelihood of success. But regrettably, fewer than half of those who suffer from a disorder will look for and accept therapy. Treatment for eating disorders typically consists of combining dietary counseling and monitoring, psychotherapy, and in some circumstances, medication. This is because eating disorders have complicated effects on both the body and mind. The majority of eating disorders can be treated with evidence-based psychotherapies, such as cognitive behavioral therapy and family-based therapy. These are conversation therapies that provide patients the tools they need to cope with the psychological issues that underlie the symptoms of eating disorders. Researchers are also looking into therapies other than psychotherapy, like transcranial magnetic stimulation, because not all patients will respond to these treatments. A severe eating disorder case can lessen the likelihood of death with effective therapy. The stigma around eating disorders can be extremely strong, but education for people, families, and communities can lessen the feeling and increase access to treatment.